Have you ever wondered about the silent forces at play inside your body, things impacting your health without maybe a single symptom? Today, we're pulling back the curtain on one of the really big ones, cholesterol. You won't feel it, probably won't see it, but this waxy sort of fat-like substance, it's constantly working behind the scenes in every cell. It's essential for everything from making hormones to vitamin D. And this is the crucial part, too much of it can quietly become a profound problem.
And that's exactly what we're aiming to unpack today. Our mission in this deep dive, using the great sources you've provided, we've got Mayo Clinic, Medline Plus, the American Heart Association insights here, isn't just to define cholesterol, it's to really shed light on why it matters so much. We'll look at how it's tested and, importantly, equip you with, practical, solid knowledge to manage it. Think of this as your guide to understanding that often confusing lipid panel.
Okay, let's dive right in that. So cholesterol plays these absolutely vital roles, right? Like a master builder inside us. And the fascinating thing is our body actually produces all the cholesterol it needs. But we also get it from food, specifically animal foods, things like egg yolks, red meat, cheese. So if it's so vital, how does it become a problem? And how does it even travel around our bodies?
That's where it gets really interesting. Because cholesterol being fatty can't just dissolve in blood, which is mostly water. It needs special transport. Think of them as tiny vehicles cruising through your bloodstream. These are called lipoproteins, basically fat plus protein packages. And there are different types, each with a very distinct job.
Right, so it's not just cholesterol is one thing, it's the type or maybe the vehicle it's in that matters. This is where we get into good and bad, isn't it? Let's start with the one that usually gets the bad press, LDL. What's its role, and why is too much of it a problem?
Exactly. LDL stands for low-density lipoprotein, and it's earned that bad cholesterol label for a good reason. Its main job is delivering cholesterol from the liver out to cells all over the body. But the trouble starts when you have too much LDL circulating. These extra particles tend to deposit themselves, along with other substances, into the walls of your arteries. This creates a sticky, fatty buildup we call plaque. And that process, it's called atherosclerosis, basically narrows your arteries, it restricts blood flow, and that significantly bumps up your risk for serious heart problems.
So LDL is like a delivery truck that ends up dumping excess cargo, clogging up the highways or arteries. Makes sense. But then there's HDL, the one often called the hero. How does that one work?
That's a perfect analogy. HDL, high-density lipoprotein, is our good cholesterol. Instead of delivering cholesterol to the arteries, its job is more like a cleanup crew. It travels around, scavenging that excess LDL cholesterol from the artery walls and carrying it back to the liver. Once it's in the liver, it gets processed and removed from the body. So HDL helps keep those arteries clearer, preventing those traffic jams. It's crucial. Though it's worth noting, HDL only carries a fraction, maybe a quarter to a third, of the total cholesterol in your blood.
Okay, cleanup crew. I like that.
Mm.
And there's another one you mentioned, VLDL. Sounds like LDL. How's it different?
Good question. VLDL, or very low-density lipoprotein, is also considered a type of bad cholesterol because, yes, it also contributes to that plaque buildup. But here's the main difference. LDL's main cargo is cholesterol itself. VLDL's primary cargo is triglycerides. So while both contribute to plaque, they're carrying slightly different things. High VLDL is another risk factor we need to watch.
Triglycerides. That's the other number you always see on that lipid panel report. What exactly are triglycerides, and why worry about high levels?
Right. Triglycerides are actually the most common type of fat in your body. Their main function is energy storage. They basically store excess energy from the calories you eat, especially carbs and fats, tucking it away in fat cells for later. Now, high levels are often linked with things like being overweight, eating a lot of sugary foods, or drinking too much alcohol, smoking, not being active, and also diabetes. They often travel together, these conditions. So high triglycerides are an independent risk factor for heart disease as well.
Wow, okay. So understanding these different players, LDL, HDL, VLDL, triglycerides, really changes how you see that test result. It's not just one number, it's like a whole internal ecosystem. And the thing that really stands out is what you said earlier, high cholesterol is often a silent threat. Why is that? Why don't people feel it?
That's such a critical point. It's called silent, precisely because, well, in almost every case, high cholesterol causes absolutely no noticeable symptoms. You can't feel plaque slowly building up inside your arteries. You just don't. And this lack of warning signs is exactly why getting tested is so incredibly important. It's really the only way to know if your levels are putting you at risk.
That's quite sobering, really. So let's connect the dots. How does this silent buildup, this plaque, eventually lead to the really serious health problems?
Okay, so picture those plaques made of cholesterol, fat, calcium, other stuff sticking to the artery walls. Over time, they harden and make the arteries narrower and stiffer. That's atherosclerosis. And when arteries narrow, less blood can flow through.
And restricted blood flow. So that's when things get dangerous, leading to major events, right?
Absolutely. High cholesterol is a major driver of really serious conditions. Coronary artery disease, for instance, the most common type of heart disease. High cholesterol is a key factor. If one of those plaques ruptures, a blood clot can form suddenly. If that clot blocks blood flow to the heart muscle, that's a heart attack. If the clot blocks blood flow to the brain, that's a stroke. Plaque can also build up in the arteries going to your legs and feet, causing peripheral artery disease, or PAD. That can cause pain when walking and other issues. It can even cause angina, that chest pain or pressure you get when the heart arteries are narrowed.
It's like a terrible domino effect.
Yeah.
And I know other common conditions like diabetes or high blood pressure, they can make this whole situation even worse, can't they?
That's a crucial link. Diabetes, for example, often messes with your cholesterol profile. It tends to lower your good HDL and raise your bad LDL and triglycerides. And high blood pressure. It damages the inner lining of your blood vessels over time. This makes it easier for LDL cholesterol to stick and build up plaque. So yeah, having diabetes or high blood pressure alongside high cholesterol unfortunately creates this dangerous synergy, multiplying the risk.
Okay, so given it's silent, how do we actually find out our levels? That's the cholesterol test, the lipid panel, right?
Exactly. The complete cholesterol test, sometimes called a lipid panel or lipid profile, it's just a straightforward blood test. It gives you that snapshot. Total cholesterol, LDL, HDL, and triglycerides, a really key piece of health information.
Simple blood test. Got it.
Yeah.
Is there any special preparation needed? Like fasting?
Generally, yes. The standard advice is to fast for about 9 to 12 hours beforehand. That means nothing but water. But, and this is important, always check with your doctor or the lab. Some newer tests might not require fasting, so it's best to confirm. The procedure itself is really simple. Just a quick blood draw, usually from a vein in your arm. Minimal discomfort.
Right. So who needs this test and how often? I feel like the recommendations cover more people now, not just older adults.
You're right. They're pretty broad now.
Yeah.
For kids, believe it or not, the first screen is often recommended between ages 9 and 11, then again between 17 and 21. And if there's a strong family history of high cholesterol or early heart disease, or if the child has obesity or diabetes, screening might even start as young as age 2. For adults without known risk factors, generally every 4 to 6 years is advised. But if you do have risk factors like high blood pressure, diabetes, that family history, or if you're already being treated for high cholesterol, then you'll need more frequent testing for sure.
Okay, so we get the test, we have the numbers, what do they actually mean? Can you give us a quick rundown of desirable ranges?
Sure. Keeping in mind these are general guidelines, and individual targets can vary. In the U.S., we use milligrams per deciliter, mgdl. For total cholesterol, ideally below 200 milligdl. For LDL, the bad one, optimal is generally below 100 milligdl for most healthy people. If you already have heart disease or at very high risk, your doctor might aim for below 70 milligdl. For HDL, the good one, higher is better. 60 milligdl or above is considered protective. There are slightly lower thresholds sometimes used for men versus women, but aiming high is good. And for triglycerides, below 150 milligdl is desirable. But I have to stress, these are just general numbers. Your doctor looks at your whole picture, all your risk factors, to decide what your target level should be and what treatment, if any, is needed.
That makes sense. It's personalized. Now, most of this seems linked to lifestyle and monitoring. But sometimes it's just in your genes, isn't it? High cholesterol can be inherited.
That's absolutely right. It's a really important piece of the puzzle we haven't fully touched on yet, the genetic factor. High cholesterol can definitely run in families. And the most significant example of this is a condition called familial hypercholesterolemia, or FH.
Familial hypercholesterolemia, FH. That sounds serious. What exactly is it? What makes it different?
It is serious. FH is basically an inherited genetic defect that affects how the body removes LDL cholesterol from the blood. So people with FH are born with very high LDL levels, sometimes extremely high. And these levels stay high their whole lives unless treated. The impact is huge. Untreated FH can increase the risk of heart disease by up to 20 times compared to the general population. If you inherit it from one parent that's heterozygous FH, heart disease can show up as early as your 30s or 40s. If you inherit it from both parents, homozygous FH, which is much rarer, heart disease can start in early childhood, sometimes even by age 2 or 3. It's devastating.
Wow, 2 or 3 years old.
Yeah.
That really highlights how powerful genetics can be here. What causes this faulty LDL removal?
It's usually caused by mutations in specific genes. Most commonly, it's the gene for the LDL receptor, the part of the cell that's supposed to grab LDL from the blood. Mutations in other genes, like one called PCSK9 or another called apolipoprotein B, can also cause FH. What's really concerning is how often it goes missed. Estimates suggest about 1 in 200 adults has FH, but maybe only 10% of them even know they have it. It's a major hidden risk.
1 in 200. This is surprisingly common. So if someone in a family gets diagnosed, checking relatives is critical.
Absolutely critical. It's called cascade screening. If one person is diagnosed with FH, all their first-degree relatives, parents, siblings, children should be tested. It's the best way to find others who might be affected. And here's a key takeaway about FH. Diet and exercise alone are almost never enough to control the very high LDL levels. Medication is usually essential, often high-intensity statins, sometimes other drugs like ezetimibe, or the newer PCSK9 inhibitors. In really severe cases, a procedure called LDL apheresis might be needed to filter the cholesterol out.
Okay, so genetics plays a big role for some. But for most people, lifestyle is still a huge lever they can pull,
Right.
even if there's some genetic tendency involved.
Absolutely. For the vast majority of people with high cholesterol, lifestyle changes are the cornerstone. They're often the first step in treatment. And even if you do need medication, these lifestyle changes can make the medication work better. They're fundamental.
Let's talk practical changes.
Mm-hmm.
Heart-healthy eating, what are the big hitters there?
Okay, diet. It's not just about one magic food. It's about the overall pattern. First big step, cut down drastically on saturated fats. That means less red meat, especially fatty cuts, less processed meat like sausage and bacon, and limiting full-fat dairy products. Second, eliminate trans fats. The good news is the FDA ban on partially hydrogenated oils means they're mostly gone from processed foods now, but it's still good to check labels on things like margarines or baked goods sometimes. Then, really boost your soluble fiber intake. Think oats, barley, beans, lentils, apples, citrus fruits, Brussels sprouts. Soluble fiber actually helps trap cholesterol in your digestive system and prevent it from being absorbed.
What about adding things like good fats, omega-3s?
Yes, definitely. Including sources of omega-3 fatty acids is great for overall heart health, though they don't directly lower LDL much. Think fatty fish like salmon, mackerel, herring, also walnuts and flax seeds. They can help with blood pressure and triglycerides. Also, foods fortified with plant sterols or stanols can help block cholesterol absorption. You find them in some margarines, yogurts, and orange juice. Other potentially helpful foods. Avocados seem good, maybe turmeric, pulses, nuts like almonds and walnuts, whole grains, maybe even green tea show some benefit. On the flip side, things to limit. Unfiltered coffee, like from a French press, can actually raise LDL for some people. And definitely watch the added sugar intake too much can raise triglycerides and slightly increase LDL.
Okay, diet covered. What's next? Exercise has to be key.
Oh, absolutely. Regular physical activity is non-negotiable for heart health. Moderate aerobic exercise, think brisk walking, swimming, cycling, actually helps raise your HDL, that good cholesterol. Your cleanup crew gets more effective. Aim for at least 150 minutes of moderate activity per week. That's like 30 minutes 5 times a week. Or if you prefer vigorous activity like running, aim for 75 minutes per week. And don't underestimate just being more active throughout the day. Take the stairs, walk during phone calls, park further away. It all adds up.
Right. And smoking. Surely that impacts cholesterol too.
Hugely. Quitting smoking delivers some of the fastest health benefits you can get. It's amazing how quickly the body responds. Within just 20 minutes of quitting, your blood pressure and heart rate start to drop back towards normal. Within 3 months, your circulation improves, your lung function starts to recover, and get this, within 1 year of quitting, your risk of coronary heart disease is cut in half compared to someone who still smokes. It's a massive win for your heart and vessels.
Wow, half the risk in just a year. That's powerful. What about weight?
Maintaining a healthy weight is definitely important. Carrying extra weight, especially around the belly, contributes to higher LDL and triglycerides and lower HDL. But the good news is, even modest weight loss, say 5 to 10% of your body weight, can make a significant improvement in your cholesterol levels. Again, small changes help. Switching sugary drinks to water, managing portion sizes, finding ways to move more. It's about sustainable habits.
Okay, last lifestyle point, alcohol. There always seems to be conflicting info. Does it help or hurt cholesterol?
Yeah, that one's a bit nuanced. Some studies show that moderate alcohol consumption might be linked to slightly higher HDL levels, the good cholesterol. However, and this is a big however, the potential benefit is small, and it's definitely not a reason to start drinking if you don't already. For people who do drink, moderation is absolutely key. That means up to 1 drink per day for women and men over 65, and up to 2 drinks per day for men 65 and younger. Exceeding that regularly increases risks for many health problems: high blood pressure, liver disease, certain cancers, stroke, that far outweigh any tiny potential HDL boost.
Right, moderation is crucial. So we've covered lifestyle extensively, but sometimes those changes aren't quite enough, or the risk is just too high and medication enters the picture. What's the main type people usually hear about?
That would definitely be statins. They are really the cornerstone, the workhorses of cholesterol-lowering medication. You'll recognize names like atorvastatin, Lipitor, rosuvastatin, Crestor, simvastatin, Zocor. How they work is pretty clever. They block a key enzyme in the liver that's needed to produce cholesterol. When the liver makes less cholesterol, it compensates by pulling more LDL cholesterol out of the bloodstream. So your blood LDL levels go down, often quite significantly.
Statins are known to be very effective, but people often worry about side effects, especially muscle pain. How common is that, really?
Muscle pain is definitely the most talked about side effect, and people do report it. But it's important to understand the context from large studies. While some muscle discomfort can happen, the actual rate of significant muscle pain directly caused by the statin itself, compared to a placebo, is relatively low, maybe around 5% or even less. There's this thing called the nocebo effect, basically the opposite of placebo, where expecting a side effect makes you more likely to feel it. That seems to play a role for some people. Now, there is a very rare but serious muscle condition called rhabdomyolysis, but that's extremely uncommon, like a few cases per million people taking statins.
Okay, so the muscle pain risk might be lower than perceived for many.
Right.
What about other potential side effects? Liver issues, blood sugar.
Yeah, those come up